Our guest today is Lisa Borowski. She's a state rep she's state rep 168 for Pennsylvania. Lisa is our guest today, and she's going to talk about her reelection, candidacy for reelection, and a number of items that I have listed for to speak about. Lisa, thank you for coming back on the channel.
Thank you.
I've known Lisa since you were school board and Radnor commissioner, and now you're state rep 168.
Yeah.
What does that encompass?
Being a state rep or the 168?
No, 168.
All of it? The 168?
Well, I'll ask you the other thing later.
Okay.
All right.
So the 168th State Legislative District. First, thanks for having me. I'm always glad to be here and see you. But the House District 168 includes Radnor Township, Newtown, Edgemont, and about half of Middletown Township. The other half is in the 161st with Representative Leanne Kruger.
So you're not in, Middletown, Brookhaven Road?
So no, so I'm not on the Brookhaven side. So I'm all the way up to like where Riddle Hospital is. So on Route 1, Riddle up to like Lenai Road. And then if you go down 352 all the way up to the intersection, there's that 5-point intersection there. So, and then it becomes Rep. Kruger's district.
What is the general functions of a state rep?
So I'm here to serve the constituency of the 168th. So my office, so I have a district office that's located in Newtown Square. And from that office, we provide any state-related services that people might need. So if you need a new birth certificate, and you're born in the state of Pennsylvania, we can also help you if you weren't. But you need a new birth certificate, you need your driver's license, anything PennDOT related, we can help with. If there's paperwork that needs to get done, we can get that paperwork for you. We can help you fill it out. A lot of times people might need some help. And then I serve as courier. And it's very convenient. The PennDOT office in Harrisburg is right outside my office in the Capitol. So I will run paperwork back and forth. If you need a new license plate, if so anything PennDOT related, we can help people with. We also do SEPTA cards. So you know SEPTA, so I know you used to work for SEPTA. SEPTA offers a senior pass, so anyone 65 and over can ride SEPTA for free. And we do those cards right in our office. We collaborate with SEPTA on that. So you come in, you get your picture taken, we fill out the paperwork, we give you a paper that you can use until you get your actual card from SEPTA.
For seniors?
Mm-hmm. Anyone 65 and over. Yep.
Before you go on, I have to ask you, I've known you for, 10 years maybe?
Yes,
and I know. You're really driven, and I admire a lot of what you do. What really prompted you to go from school board to Radnor Township Commissioner to where you are now?
So, well, first of all, I loved being a school board, but I loved being commissioner of Ward 4, and Radnor's a fantastic township, so I loved that job, and honestly never thought I would have an opportunity to run for a higher office. The area that I live in Radnor used to be represented by State Rep Jennifer O'Mara. She's fantastic, and no need to try to while she was in that seat to run for anything more. But with the redistricting that happened after 2020 in the state, it changed where Radnor was located, the district that Radnor was in. It was drawn together because it used to be split in half. But it was drawn together and moved into the 168th, which presented an opportunity for a Democrat to run for the seat. So after talking with many people and many people coming to me and suggesting that it would be a good opportunity for me, and talking over with my husband and my boys, decided to take a shot and run for it. So I love serving my communities, and to be able to do this full time is it's really, to me, it's an honor, and it's a thrill every day. I meet new people every day, have an opportunity to work with people on great projects, bringing great opportunities into the district, and to really help people. So that's what I love doing, and if I can do that full time every day, that's great.
You don't have to tell me the answer to this. I think I know. You probably have, or you think about having ambitions of doing, going beyond state rep. It's just a yes or no answer.
So I want to say no, because I just got this job. I was just elected. I've only been in it for a year, even though it's time to run again. I feel like there is so much that can be accomplished, and I want to be a voice in that, and be the voice for the people that I serve as we move forward some really important legislation. It's I saw this when I was a school board member. Pennsylvania is so far behind. We are really far behind in so many ways when you compare yourselves to other states. So, what can we do to, advance our state, make it better for everybody that is living here? And I want to have a seat at the table when it comes to that. I want to be the voice for the people that I serve. And I really love this job so far. I don't have ambitions for another.
I was, being to talk about the state, and it's not. I didn't have it on my list of things that I wanted to ask you about, which I will. One of the things that I think Pennsylvania is far behind in is the Liquor Control Board. Is that something that you think will ever get changed, or has it ever been a topic of discussion?
You mean, what do you mean?
Like, why isn't it independently owned, like other stores, and competitively priced? That would attract people to go to Delaware, or those that have residences in New Jersey go to buy it there when Pennsylvania could use that revenue. Is that something you ever see? So,
we generate a lot of revenue from the state,
Liquor Control Board?
Yeah. So we, I'm not really too concerned about the revenue. It certainly is beneficial to the state, but I think that unwinding something like that is probably, that's been in place for so long. I remember going to there used to be, when we lived in Havertown, we called it the State Store. I still call it the State Store.
Yeah, me too.
It's like, I still call Mac machines.
I'm old.
I'm old too. But I can remember you used to go, and there was like a counter, and you would ask for what you wanted, like behind the counter. I can remember going in with my, with my parents. So, I think unwinding that is definitely a challenge. There's a lot of, there's a lot of employees in that system. So, those people who have jobs, that's definitely something that we need to consider as well. So, and you take that private, what happens to the employees? So, I don't know that that's a top agenda item. I know it's been discussed. I don't sit on there is a committee that oversees or works on those issues. I don't sit on that committee, so I'm not 100% sure, where the conversations are with that. But I would certainly think that unwinding that, and certainly wanting to make sure that we're focused on the employees that are there, because it does employ a lot of people.
Yeah, I would think so.
Yeah.
Do you have any opinions on marijuana?
So you mean legalizing recreational marijuana? I am learning a lot about that right now. So I sit on the health committee. We are actually having an informational hearing. I think it's next week. We've already had one before. So that is a high priority discussion in Harrisburg right now. Where that's going to shake out, I'm not sure. And as I said, I am still learning a lot about it. I do think that we are leaving potential or a lot of revenue on the table by not having legalized recreational marijuana. But what is the trade-off when it comes to that? So understanding what that looks like, because it is not something that I am particularly familiar with. but I'm working really hard to familiarize myself so that I can take a strong position on that.
Well, I'm not a big proponent of it, but as you know, I did a film or co-produced a film about Kensington. And I absolutely, no one is going to tell me, and this is not, it's your show, not mine, that marijuana is not a gateway drug. It absolutely is, and it would be the biggest concern I have with so many. We're fortunate that we were close enough to Kensington, and there is enough people that are in Kensington that are from around here, from Radnor, Lower Merion, Bluebell, Tredyffrin, that are victims of drug abuse. And that would be, I know the money aspect of it, but I also have other, I also have other concerns.
And I don't disagree with you there. And that is why I'm really working hard to better understand, what that looks like. It's definitely a concern of mine. I would want to make sure that, access is controlled. We don't certainly want, I think, our young adults, our young people, being able to access something like that. So I have a lot to learn in that space. And I am glad and grateful to our leadership for having Chair Frankel, who leads our health committee, and Chair Rapp, who is the minority leader, for having these conversations, bringing in the experts, because I can't know everything and I can't be an expert in everything. So I need to have those opportunities. So I'm grateful for that.
Well, I do, and I do understand the revenue side of it. So I certainly can appreciate that. I think it's really funny when anytime I filled out any medical information, I'm always asked about, do I use any recreational drugs? I'm a child of the 60s and I didn't do recreational drugs then, Anyway, I won't get into that.
I can let you know when the hearing is, so the public can view these hearings.
Oh, okay.
So that's an important thing for people to know too, is that any hearing that we're having, any committee meeting, anything that happens in Harrisburg, people can access that through the state government website.
Oh,
there's
we'll put that
there's
on
live streams.
Okay.
Yeah, so
Okay.
I'll get you that information. People should know that.
All right. So now back to the reason why I've had you here is what about healthcare? Can you talk about that? Anything that you can bring up?
Yeah, I can probably bore you on that for a long time.
Well, that's fine.
So, my background is healthcare. I spent 30 years working in healthcare. And I am very concerned, as is my colleagues in the Delaware County delegation especially, as to what is happening in our healthcare system. Not only here in the state of Pennsylvania, but certainly nationally, it's a concern. So for me, one of the most important things is making sure that people have access to good quality health care, in places where it's easy for them, where they have the best providers and can be afforded the best care. So in Delaware County, we have a huge issue right now. One of the major systems, Crozier Health System, they were purchased by a for-profit organization. That for-profit organization has come in. They have closed 2 of the hospitals in the communities that they were serving. So Delaware County Memorial Hospital was closed over in Drexel Hill area, and Springfield Hospital was closed. So closing those means people lose their access to their emergency departments. They lose access to physicians. They lose access to maternal child health care. So that is a huge concern. We are very concerned about the viability of the hospital down in Chester. So Crozier Hospital down in Chester is for this area, it's our level 1 trauma center. It is a teaching hospital. It is a place, for a community that is traditionally underserved in many other spaces. So to lose that hospital down there would certainly be detrimental to the entire county. Riddle Hospital is located in the 168th.
Right.
I have spent many times, many meetings with the administration there. They have seen a huge influx of patients because of the closures, that they are, working really hard to make sure they're providing the best care. But you can't take the hospitals that are left, and it's difficult for them to absorb everything and turn on a dime to do that. They just opened a beautiful new pavilion at Riddle, and they are already at max capacity there. So, and it takes a really long time to expand. You can't just say, oh, we're gonna add a unit and do it like the next day. It takes a really long time, not only from the construction standpoint, but from the perspective of, the regulations and making sure that, everything gets done in accordance to, with the Department of Health and things like that. So it's a process. But our hospitals that are left are seeing a huge influx, and people are having to travel far in order to secure services. And again, traditionally, the hospitals that are being closed are hospitals in communities where the need is the greatest. So that is a huge concern of mine. I am working on legislation so that we can give and actually Senator Carney, who is one of the senators in the 168th and here in Delaware County, has already introduced legislation to help make sure the Attorney General's office has what they need to ensure that these bad actors, and I'm not saying all for-profits are bad actors, but there are bad actors that have a history of coming in and taking over health systems and basically dismantling them. We saw it at Hahnemann Hospital. Bad actors coming in there, right, dismantling it, closing things, and then finally, ultimately, closing the entire hospital and leaving communities without services and leaving the burden on the hospitals that are left to try to absorb that. And it is really challenging. And it impacts quality care. It impacts our providers. It impacts the patients. So, we need to be working hard to make sure that we are supporting our healthcare institutions, supporting the industry here in the state of Pennsylvania, incentivizing more people to enter the profession. We have a shortage of nurses. We have a shortage of other support staff, from the people who work in the environmental services department to the food services to, we need all of those people, right, to run a hospital and take good care of patients. So there are a lot of challenges that we're working really hard on, but, I am definitely, for me, that is a big focus. And, I'm looking to introduce legislation, working with my colleagues across the aisle to see what we can get done in order to make sure we don't have things like this happen in our communities.
Well, the incident down in Ridley with the hospital there, and they owe $350,000
and that is Prospect Medical, and they are the ones who bought Crozier. So that is that health system. Yeah. Now they're working. We meet with them monthly, the Delco delegation, and to hear what's happening and make sure that they are moving forward with the things that they have told us they are going to do. We're keeping close tabs on them.
But they increased the community's taxes by a large amount of money.
It was I think a 400% increase for the people that live down there. And it is not right. No. It's not right. So, yeah.
Well, you have an interest too, as your dad was a physician.
Mm-hmm. My mom was a nurse.
Right. I was going to say that next.
I never worked in direct patient care. That was never... No. So I worked in...
but I can tell you're very passionate about this.
I am. Yeah. I am. And
I think it is important, because that's... You're right. You're neglecting a lot of... yes. First responders. What about first
One of my
responders?
favorites are first responders.
Really?
Yeah, for sure. So, being a commissioner in Radnor, we have our own municipal police force, which we, fund and manage as a township. And fortunate to have the Radnor Fire Company, who provide not only fire service, but EMS as well. So I learned a lot from them while I was a commissioner, and learned a lot as, someone responsible for funding those necessary services about the many shortfalls when it comes to funding, and how that is being pushed down, and becoming the responsibility of the local municipalities. So specifically for our fire and EMS, a volunteer system pretty much in the state of Pennsylvania, which is great. It's not only providing a necessary service for our communities, but it's also, it is our communities. So, it's, and for many years, the people live in the communities, they were the volunteer firefighters, they are the, volunteer EMS, but things have really changed. And it is it's very expensive for these volunteer fire companies to keep their services going. They are, there's definitely been a drop off in volunteerism. People are busy, and to become a volunteer firefighter, I hope people appreciate those who do, because they go through so many hours of training, many hours of training, that a lot of times, people, when you're working, you're raising a family, that's a tough commitment to make. So, how do we manage that moving forward? Well, first off is funding. I'm very proud of being able to, I had a bill, myself and a colleague in Montgomery County, we had a bill to get more Medicaid funding for for the services that are being provided by our EMS. So they weren't being reimbursed for transportation of patients to and from the hospitals, unless they were transporting people over 20 miles.
You mean the vehicles?
The vehicles,
Okay,
yeah, they
so
call it loaded miles.
Okay.
I learned a lot. They call it loaded miles,
Yeah.
so they weren't being appropriately reimbursed. So we had a bill to change that. The legislation didn't quite make it through, but it did come out of the House with full support, so bipartisan support. Because I could say one thing about our House legislature, we fully support our first responders, no matter what side of the aisle you sit on. So we were lucky. We were fortunate then the provisions did make it into the fiscal code that was signed by the governor. So there's more ways to get things done than just legislation. So I'm proud of that, but they need more help. So, I've spent a lot of time engaging with and working with our fire companies as well as our townships to figure this out, because what might work here in certain areas may not work in more rural areas. And if there's one thing I've learned in this past year is that Pennsylvania is an extremely diverse state. The needs are very different in areas. The accessibility is very different. So, and when you pass legislation, so just like when I was a ward commissioner, what might have been good for Ward 4, was it going to be good for the whole township? You have to look at it now statewide. So that is definitely a goal. I'm one of the co-chairs of the new Emergency Services Caucus. We are going to be launching that in the next couple weeks. So, and that's where we will be focused on legislation designed to help our fire, EMS, and our police as well.
Did you find it the transition going from Radnor to Harrisburg difficult? You certainly weren't intimidated, knowing you the way I know you. You're not at all intimidated.
Oh, I'm not gonna lie, it was definitely a little intimidating. I basically became a small business owner because I have my district office. You have some help from there are offices out in Harrisburg that will help you. Help me find a location and hire. But I was responsible for hiring my staff. I'm responsible for managing the day-to-day activities of the office. I have a fantastic chief of staff, Marie, who does that. But that is where the real work is done. So, that was definitely intimidating. I've never been a small business owner. So, but, we've got that up and running and working really, really well. I'm proud to say we did over 4,000 pieces of casework just last year alone. So, so we are really moving forward quickly and have spun up well in that area. My staff is fantastic. So, but I think a lot of the lessons I learned as a commissioner have translated well into this role, especially kind of on the legislative side, and also really just knowing the issues on a local level. I feel like I have a perspective, so I'm able to, when I talk to the supervisors in Newtown and they're talking about MS4 or they're talking about stormwater, I know what they mean. I know what and I get it. And, then when legislation comes up in Harrisburg, I understand that. How is that going to impact my communities, my municipalities? Is it going to be helpful? So I have, I think, a good perspective from that angle. I think it's been helpful.
You ran a really first-class campaign I noticed you did some really. Was that your idea?
I had a lot of people helping me. I will never say that it's all my idea. Definitely the buck stopped with me. But I had a lot of really creative and talented people working with me to help me do that.
Yeah, that was a well-run operation. Mm-hmm. One of the things I guess I wanted to bring up about your being reelected is that the primaries on April 23rd?
Yes.
Now, just because I know that is also Passover, and so what would be for those people that should they request a mail-in vote?
Yeah, so we worked really hard in the State House and just could not come to an agreement on changing the date of the primary. Quite frankly, I think it's something that should have been addressed maybe 2 years ago or a year ago instead of waiting until several months before this was going to happen. But, we deal with the cards that we are dealt, and we tried. There was several pieces of legislation to try to change the date. We were unable to get any sort of agreement on this. And so the date remains the same, April 23rd. I hope this teaches us to look forward a little bit when we make our calendars and try to have a little vision when it comes to making sure that we're not disenfranchising anyone when it comes to voting. But yeah, so it is the 23rd, and I would advise anyone who has a concern about trying to get to the polls, you can vote by mail. It is easy enough to do. People can request their ballot. You can go to votepa.com and request a mail-in ballot. I'm pretty sure, don't quote me, but I think if you requested your ballot for last year, it still is good for the primary. So you should receive it automatically, or you should get something automatically from the county to be able to request it again. So, but everyone can go to votepa.com. And you can check your registration. You can check if you requested a mail-in ballot. They have it all there. It's super easy. I just did it for my parents to change their addresses since they moved, so to change their addresses last night.
Yeah, I think it's also fair to say that you do a lot of work with veterans too.
Mm-hmm. Yeah.
You're much involved with the Delaware County Veterans Memorial Association. Mm-hmm. And their events. So I think that's a nice shout out for you.
Yeah, we have a lot. We have over 2,500 veterans that have identified as such in our district, and I'm sure there may be others. We do a lot of veteran services in our office. So,
what type of veteran services do you provide?
So anything. So we can support them in getting access to anything that the state provides the veterans. So any sort of discounted services. Veterans, I believe, can get discounted services on registration and things like that. So anything that is state related, we can help our veterans with. We had an amazing Veterans Day breakfast back in November. It was, we had over, I think, 60 veterans come out. We had it at the Tyler Arboretum, which was beautiful. If anyone's ever been there, we had it at the barn there. It was so nice. So, yeah, and I've become very involved with the DeBatone family and the work that they do with the veterans, the Delaware County Veterans Memorial, which is also located in my district.
So they donated the land.
Yeah, they did.
Claude DeBatone did that. You probably work with his daughter now.
I work, with Nicole and Paul, his son Paul.
Right.
So, so I've become very involved there. Supporting their efforts. And the programs that they have. It's fantastic. So I think they say that it is the largest veterans memorial outside of Washington in the mid-Atlantic region, or I think that's what they say. Yeah. So if anyone has not been there, I would advise you to go. It's a really special place. They also have a website where you can learn more about it, and you probably know the the URL off the top of your head. I don't know it off the top of my head.
I do know. Yeah, and give yourself a shout out for the things you do with veterans, because I admire that. And that's the end of our time. Did we miss anything?
Already? I don't know.
It.
We could talk for like hours, right?
Is there anything you want to add?
No, definitely just, everyone come out and vote. We have, important elections coming up. So I'm always encouraging everyone to exercise your right.
April 23rd.
Yep.
Get out and vote.
Yeah.
I can't tell you who to vote for, but I think you can get an idea. But I'm not allowed to say that. But make sure you get out and vote. And if you can't, get a mail-in vote. And that'll be on the lower third of the screen. Lisa, thank you very much.
Thank you, John.
I really appreciate it. It's another adventure in Faces of the Main Line. And this is John Ricciuti. Thank you for the time. Get out and vote.